So nice to see you again. A lot of things have happened since we last spoke, and I really look forward to hearing your update on immigration issues. So first, let me ask you, can you talk about the implications of the passage of the Budget Reconciliation Bill for immigrant children and families, broadly speaking, and then include any insights on how these changes in policy might impact students' attendance and engagement in school?
Sure, and thanks for having me back. A lot has happened since we last spoke. So the passage of the budget reconciliation bill, really across the board represents a devastating blow to children and families with low incomes across the country. And it really sets the country backwards on decades of progress to make the American dream more attainable for all. Because of this bill, millions of kids, citizen and non-citizen alike, in both immigrant and native born families will go hungry, lose health coverage, and fall into poverty. The bill includes historic cuts to healthcare and nutrition assistance, and it also expands the harmful immigrant eligibility restrictions from the 1996 Welfare Reform Law, cutting off access to Medicaid, CHIP, the ACA, and SNAP for the first time to lawfully present refugees, asylees, and other humanitarian immigrants, including domestic violence survivors, populations that have historically been recognized as particularly vulnerable and in need of additional supports. Refugee children make up nearly half of all refugees settled into the US. Now, an estimated 50,000 children are barred from programs like SNAP due to the new immigrant restrictions under this bill. And then, in addition to these cuts, for the first time, up to 2.6 million US citizen children no longer have access to the child tax credit, a proven tool for fighting child poverty, simply because they don't have at least one parent who is filing with a social security number. And if that isn't enough, these resources will instead be used to turbocharge what has been a devastating mass deportation agenda. The bill includes more than $45 billion to jail families indefinitely in conditions that medical experts have found to be completely inappropriate for children, and more than $30 billion to hire more ICE agents and expand partnerships between immigration enforcement and local police to really continue to spread fear in communities and disappear community members and rip parents away from their kids. There's more than 5 million children at risk of losing a parent to deportation with lifelong consequences for their health and well being. We've already witnessed ICE arrest moms and dads all over the country and deport even US citizen kids who are fighting cancer with no regard to their medical needs.
Mm.
And the bill also cruelly targets unaccompanied children. These are kids who enter the US alone, often searching for safety or refuge of some kind or to reunify with family here. And it actually makes it harder for them to reunify with their family in the US, making it by creating unreasonable fees, by creating fear about information that they might collect from their sponsors. It allows for their rapid return to the country they fled without the opportunity to go before a judge. And it subjects children as young as 12 to concerning physical examinations by the government. And so, in other words, this bill really turns an immigration system that is already harmful to children to one that denies their humanity altogether, treating even asylum seeking toddlers and babies as criminals rather than children deserving compassion and, at the very least, due process. And so, to your question about the impact to children's attendance and engagement in school, we're concerned.
Uh-huh.
We're very
Uh-huh.
concerned. I mean, first,
Absolutely. And we've seen the first studies showing the declines in attendance. And I can't even imagine what it's like to sit in a classroom and be thinking about all these things while you're separated from your family.
exactly. You're absolutely right. I mean, first of all, we know that the same children who are going to be losing access to nutrition and healthcare supports and access to the child tax credit are the very same kids who are at risk of having a parent detained or deported. And so, I mean, we know how much and we've done a lot of research ourselves at CLASP on like the impacts of immigration enforcement, and we know that children suffer short and long-term developmental harm as a result of a parent's deportation. The fear of enforcement, impacts a child's ability to learn if their parent is actually deported, and they are left with that trauma that creates immediate trauma and then long-term mental harms, which make it harder to focus in school. And then these kids are going to be faced with limited access to programs like SNAP and Medicaid that could actually help their caregivers that they're left with if their parents choose to leave them here, making it harder for them to provide for these kids. And so really these kids are facing generations of harm, and it's going to put us down a really dangerous path for being able to support them to recover in the future, because they're going to be hungrier, poorer, and that will all lead to poor academic outcomes and will compromise their ability to thrive and achieve their full potential in the future.
This is a very frightening list of cuts and policy changes and impacts. Can you give us a little bit of hope? What can schools, what can communities, what can early care programs, early childhood programs do to ameliorate some of these effects?
I think one of the things we're telling folks to do is to really understand what the changes are, what the eligibility rules, what's changed and what isn't, because there's going to be kids are going to, there's going to be millions of kids who lose access to healthcare and nutrition supports, but we don't want a broader chilling effect to deter families from accessing programs which their children are still eligible for. And there is a lot of fear and confusion because of all of the patchwork of eligibility rules now, along with like new things that we're hearing about, which I know we'll talk about shortly. And then we also there's been a lot of amazing resources created for both schools as well as childcare and early education centers for how to help families feel safer about bringing their kids to school and what policies they can put in place to try to keep their locations as safe as possible from immigration enforcement.
Thank you for that. I heard you referring to some of the other things that are going on. And I think one of the topics is birthright citizenship. So currently, it remains the law of the land, but there's a case challenging the president's executive order to take away birthright citizenship. So what would it mean if birthright citizenship is restricted nationwide or in certain states? And how might that affect students and our youngest learners?
Yes, we've all been watching this very closely. It's one of the first times we've seen a president actually issue an executive order of this kind. And I just want to be clear, any restriction on birthright citizenship would harm only one population, and that's newborn babies and their families. So let's be very clear about that. And if implemented nationwide, it would create an additional burden for all families receiving a new baby to establish their baby citizenship as well. And it would also create a burden for the hospitals that are delivering babies to be able to like figure out how to, abide by new requirements. And ultimately would also render millions of children stateless and potentially delay a newborn's ability to access federally funded healthcare in the earliest, most critical days of life. If implemented, it's estimated that it could strip 4.7 million US born children of citizenship over the next 2 decades. If implemented in some states, but not all, the country would experience this very harmful patchwork of policies where a baby's access to automatic citizenship may depend on what zip code they're born in. And it would raise alarming questions for more than just those that are targeted by this executive order. I mean, what if a mother happens to be in a state that doesn't exercise automatic birthright citizenship, but she resides in a state that does? Like, what if she's physically present but isn't in the state? Babies don't always come when they're supposed to exactly on that exact date, right? Do people have to travel across state lines for their delivery? Are those considerations they have to take? And if this deeply harmful executive order moves forward in any way, I can't stress enough, like the harms for the children who would become stateless. There's been a lot of research done on children who are stateless in other countries, as well as like what's, the barriers that face undocumented children in this country. So in addition to lacking access to critical services, they would also face challenges later in life, including when pursuing college, trying to get into college, pursuing a career, finding a job. They would essentially be second class residents, unable to vote or even obtain a passport. And it
Mm,
also completely undermines the principle behind the citizenship clause of the 14th Amendment, which was designed to ensure that all children were born equal and that, the right of citizenship would bypass like the prejudices of the day. And so I just want to reiterate once again that thanks to ongoing litigation efforts, that executive order remains blocked. Just last week, the administration issued guidance for how they would carry it out if it were implemented, which again, we just want to make sure people know that
mhm.
birthright citizenship continues to be the law of the land nationwide, and we'll be watching this very closely.
Thank you for clarifying that. It sounds almost unimplementable, but appreciate your clarification of who it applies to and what the implications are. Okay, so final question for you. Earlier this month, several federal agencies released new notices on guidance related to immigrant eligibility for federal public benefits under the welfare reform law. So Head Start is one of the programs listed in the notice from the Department of Health and Human Services. So can you explain what this notice means for Head Start and what actions providers and advocates can take? And this is very dear to the heart of the Campaign for Grade Level Reading because we know that's one of the accelerators of reading proficiently by third grade.
Yes, absolutely. Yes, we were expecting something to come as a follow-up to an executive order that was issued in February, where the president was essentially trying to say that he was trying to prevent undocumented immigrants from accessing federal public benefits, which we know they're already ineligible for. But so these all these notices were basically a response to that. And Head Start, as you mentioned, was under the notice that came from the Department of Health and Human Services. And essentially, what it does is it replaces the long-standing 1998 guidance put in place for Head Start and significantly broadens the programs under HHS that are restricted from serving immigrants. And that usually includes recipients of the Deferred Action for Childhood Arrivals program, those with temporary protected status, and undocumented immigrants. We don't know yet if the parent or child status will be considered for eligibility purposes. We won't know that until guidance comes
Mm,
from this notice. A few things to note is that the notice itself acknowledges that nonprofit organizations are not required to verify immigration status, which is something that is in statute and would require Congress to pass a law in order to change. And about two-thirds of Head Start grantees are nonprofits. But despite acknowledging this exemption, the guidance, of course, encourages nonprofit organizations to align with the agency's updated interpretation. But again, current law
mm,
protects them from doing so. And then the administration also recently rolled back its statement that the changes are effective immediately. And I just want to stress that HHS has not provided any guidance as to how Head Start programs should implement the notice. So um, it's really important that Head Start programs don't do anything right now to change the
mhm,
way that they enroll children. And it's also important to note that the Head Start Act itself states that once a child is deemed eligible for Head Start, they are eligible through the succeeding program year. So we have like at least that level, extra level of amount of time to ensure that there's no changes to the way a child is enrolled in Head Start. So any child who's been deemed eligible already remains eligible through the succeeding program year. There
mhm,
have been
mhm,
legal challenges filed, including as part of pre-existing litigation with the ACLU, which covers 6 states. Um, and there's also an open comment period right now, specifically for the HHS rule. So we are actually encouraging folks to submit public comments. There are comment templates for people who want to submit something for the entirety of the HHS notice, which covers lots of programs. And there's also CLASP is working with several partners on a template comment specific to Head Start to help support litigation efforts that folks can also consider submitting. And
Mm.
we can make those resources available
That
to
would be great. That was going to be my follow-up. It sounds like a tremendously important issue to comment on. And just to be clear, so for current Head Start programs, your advice is don't change anything until things are settled. And
right,
current rules are that they're not to ask for citizenship status.
exactly.
So it
Citizenship
parallels the
or yeah,
K-12 system where the Plyler versus Doe decision also restricts schools from asking about citizenship status as
yeah,
well.
yes, exactly.
Okay.
And I mean, I will say, of course, that no matter what happens, and although we are very hopeful that litigation efforts are
Mhm.
successful and that we're able to, in some way, either stop certain provisions from this from moving forward or to, mitigate the harm, we have been getting lots of questions about it. We've been getting questions since the executive order in February, even from Head Start programs, on whether anything has changed, even though nothing has changed as of now. And I think it's just another contributing factor to this wider nationwide chilling effect we're seeing. And there's a lot of confusion, like amongst families and amongst providers. And, you know, in a scenario, imagine a scenario where a Head Start program is housed in a K to 12 school, and if they are required to at some point ask for the immigration status of the children they're enrolling, that might raise questions for a parent who's enrolling their children in K to
Mhm.
12. So it really sets a dangerous precedent and creates additional barriers for immigrant families who already face a lot of barriers. And we know how important Head Start is to, as you mentioned, to support the success of our youngest learners. So this is really a direct attack on those children and their ability to succeed.
Mm. So a lot to track, a lot to pay attention to. Thank you, Wendy. This is very sobering information, but it's so helpful to know fact and what is and isn't in the current budget and regulations. So thank you very much for the update.
Thank you. Thanks for having me again.
Welcome, everyone. I'm so glad that you could all join us for today's GLR Learning Tuesdays session, More Hopeful Futures for Children as Collateral Damage, Potential Implications of Accelerated Deportation. Today's session will continue the conversation that we began last week when we examined proposed changes to the Department of Education and the federal investment in education. In that session, we sought to move behind and beyond the headlines and the political theater that often dominates those headlines to keep our focus on the children and what those changes might mean for them. We plan to do the same in today's conversation with a focus on the children of immigrant families who are facing the possibility of accelerated detention and deportation. What do we know about these kids? Where their families immigrated from? How long they've been in the US? How many are living in mixed immigration status households? And what all of that means. What impact do policy changes like the removal of protections for sensitive locations such as schools and early learning programs have on these children's academic and overall well-being? And what resources, tools, and strategies are available to help mitigate harm to these and all children? The Campaign for Grade Level Reading was founded with a commitment to focus relentlessly on more hopeful futures for children, especially children growing up in economically challenged, fragile, and otherwise marginalized families. That continues to be central to our efforts in our LEO webinars and in efforts to support the nationwide network of CGLR communities. So this conversation will center the children of marginalized families who might be affected by new proposed or adopted policies and or action about immigrant families. And we're delighted to host this session in collaboration with our friends and partners at Brazelton Touchpoints Center. And so I'm happy to introduce and welcome Dr. Joshua Sparrow, the Executive Director of Brazelton and a longtime leader in the field of child health and mental health and community-based prevention and health promotion, to share a few additional framing comments before we get started. Joshua?
Thank you so much, Sarah, Sierra, and Ralph. And thanks to everyone at the Campaign for Grade Level Reading for hosting today's webinar on this urgent topic. Thanks also to today's inspiring panelists, whom you will meet shortly, and to all of you for all you do. I'm just going to take a few minutes to offer a way of framing what we're facing. People who have immigrated to the United States are not the problem. The immigration system is the problem, but it can be fixed. So this framing will not be a story about a person, but instead a glance at the landscape we're all in. What has made America great has also always been its still unresolved challenge: how to respect, honor, and support the flourishing of the wide-ranging kinds of brilliance, strength, and wisdom that come from all of its peoples, the indigenous peoples who raised their children in these lands for 20,000 years, the African peoples who were forcibly brought here and who, despite the theft of their labor, raised generations of thriving and contributive Americans, and people who have fled climate emergencies, economic implosions, and political persecution from every continent on the planet to seek safety and survival in the United States, and who have used their fair chance at opportunity they found here to build a better future for their children by expanding our country's prosperity. Here at the Brazelton Touchpoint Center, we have always revered and treasured the many different and unique ways in which all kinds of families and communities create their own knowledge about raising their children. So our problem is not people who have immigrated. Our country has benefited enormously from the brains, grit, creativity, and heroic resilience of families who have immigrated to the United States. Instead, our problem is that we have not had coherent immigration policy that would provide both legal pathways to citizen and adequate funding for border security, as well as judicial due process. A bipartisan bill doing just this could have passed in early 2020, but as you all know, it was not brought to the floor in Congress so that immigration could remain a campaign rallying cry. Added to the unresolved problems that this bill would have addressed is the increasing concentration of wealth in fewer and fewer hands, leaving the majority of Americans with the daily experience of scarcity. The problem, though, is not scarcity. There is more wealth than ever in the United States and plenty to go around.
Mass deportation could actually lead to a massive loss of tax revenues and contributions to social benefits, according to research by the Institute on Taxation and Economic Policy, especially in states with high numbers of undocumented workers, such as California and Texas. Undocumented immigrants paid $96.7 billion in federal, state, and local taxes in 2022. They contributed $25.7 billion to Social Security, $6.4 billion to Medicare, and $1.8 billion to unemployment insurance in 2022, even though they are not always eligible for such programs. This group contributed $8.5 billion in taxes to California, $4.9 billion to Texas, $3.1 billion to New York, and $1.8 billion to Florida in 2022. So that's all for the facts for now, but knowledge is power, and the problem is not immigration, nor the people who immigrate here. The problem is the lack, as I said, of a coherent immigration policy that would provide legal pathways to citizenship, adequate funding for border security, and legal due process for those seeking to reside in our country. The problems caused by a lack of a coherent immigration policy are now being compounded by the flood of executive orders that will fail to replace such a policy. Instead, indiscriminate mass detention and deportation is separating children, parents, and other family members and threatening to do so to others. We all know that the trauma of those separations and the stress of living in fear of separation to come for children today can have lifelong negative effects on their health and mental health as adults. In today's webinar, we'll hear more about the harms and also how to help and about a more hopeful future. The Brazelton Touchpoints Center is honored to join all of you in your efforts to ensure that we all have the most accurate information about the harms to families, that's expectant families and families of infants, toddlers, and young children, the harms of detention and deportation of parents and other family member caregivers, and about everything we can do to prevent more harm, mitigate the harm that is already happening, and promote healing and a more hopeful future, despite the challenges of doing so while still in harm's way.
Thank you so much, Dr. Sparrow, for battling through those tech issues, but also for really grounding this and the reminder of the incredible contributions of immigrant families throughout our nation's history and the importance of systems and policies and structures that can enable them to enter the country and contribute all that they do. We are all very excited to get this conversation started, so I'm delighted to welcome and introduce our panelists for today. Welcome first to Mayra Alvarez. Mayra serves as the president of the Children's Partnership, a nonprofit or advocacy organization working to advance child health equity through policy, research, and community engagement. Welcome also to Wendy Cervantes. Wendy serves as the director of Immigration and Immigrant Families at the Center for Law and Social Policy, or CLASS, where she oversees the organization's cross-team work to develop and advocate for policies that support low-income immigrants and their families. Welcome also to Adrian Pedrosa. Adrian serves as the National Executive Director of Abriendo Puertas, Opening Doors, leading the organization's efforts to honor and support parents and caregivers as leaders and as their child's first and most important teachers. And to guide us through today's conversation, I'm delighted to welcome and introduce Cecilia Leon. Cecilia serves as the Vice President of Programs at Attendance Works, a longtime and very, very close partner of the Campaign for Grade Level Reading, where she plays a critical role in providing technical assistance and resources to communities and states working to foster everyday attendance and reduce chronic absenteeism. Thank you so much to all of our panelists, and to Cecilia, I'll turn it over to you now.
Thank you so much, Sarah, and thank you to the Campaign for Grade Level Reading for its commitment over the years to focusing on our children, and particularly the ones who most need our support. So thank you for that. I'm going to start setting the stage and invite Wendy to come on and join me to discuss a couple of questions. First, Wendy, if you would be so good as to share with us, who are we talking about? Help us understand who the children of immigrants are, what do we know about them, where they come from, and how long they've been living in the U.S. So let's get the facts straight first.
Great. Thank you, Cecilia. Happy to be here. So first, it's important to note that 1/4 of all children in the U.S., 18.4 million, are children of immigrants, meaning they have at least one foreign-born parent. For young children 0 to 6, the same statistic is true. Children of immigrants make up 1 in 4 of all young children. They also represent the fastest growing young child population. The vast majority, more than 90%, are US born citizens. And as you can see from this map, children of immigrants are growing up all over the US, and they make up approximately 1/3 of families in the US with low incomes. Next slide. They are also a very diverse population, with their families coming from all over the world. More than half are from Latin America, with 1/3 from Mexico, 1/4 from the Middle East and across Asia, and another 11% from Africa or the West Indies, and another 11% from Europe, Canada, Australia, and New Zealand. Next slide. And finally, it's important to note that the majority of immigrant families with minor children have very deep roots in the US, with many residing here for more than 10 years, just more than 50%. In fact, 42% have resided here for more than 20 years. Only 1/3 have been in the US for less than 5 years. So in other words, these are our longtime neighbors, colleagues, and friends.
Thank you so much. And Wendy, would you just say a little bit more about what it means to live for children to live in a mixed immigration status household?
Sure. And next slide. Um, so, as I mentioned earlier, while most children of immigrants are U.S. citizens, the majority of these children are part of mixed immigration status families, meaning that not all family members have the same immigration status. It's important to note, though, however, that most immigrant parents actually do have some form of lawful status, such as permanent residents or green card holders, but there are an estimated 5.2 million children who have at least one parent who is undocumented, meaning that they are currently at risk of separation due to a parent's deportation. More than 500,000 U.S. citizen children have parents with deferred action for childhood arrivals or DACA or temporary protected status TPS, two forms of status that are increasingly vulnerable right now. Approximately 733,000 children under the age of 18 are themselves undocumented. Sometimes they're referred to as dreamers. These children have no pathway to citizenship or lawful status, and many are graduating from our high schools every year with limited options for pursuing a post-secondary education and no access to work permits. And then another just over 98,000 unaccompanied children who enter the U.S. alone, were released to sponsors in the U.S. in fiscal year 2024. Historically, unaccompanied minors have been older youth, but the number of young children entering alone has increased in recent years, partly due to harmful border enforcement policies that force parents to send their young children across the border alone in order to get them to safety, given that families crossing over together have access to fewer protections. So often families are left in this having to make a really hard decision to send their kids over alone, even though they plan to come with them. But they know that they can get their kids over here to safety faster if they send them over alone. And what's important to note is that I usually refer to these above populations as the children who are the most vulnerable due to immigration policies. But I would say under the current policy context, while I still believe that these are the most vulnerable populations, I also really believe that that larger number that I covered earlier, the 18 million or 1 in 4 children who are part of immigrant families, are all facing really severe threats to their well-being under the current policy context.
Wendy, thank you so much for giving such a sense of both the diversity of the people that we're talking about, where they come from, what languages they speak, and why they come to the US, as well as the different categories or legal statuses that people have or do not have. You already alluded to what I think Josh was speaking so eloquently about at the beginning of the webinar, just about what some of the current policy context, which seems to change every morning that I look up and read the newspaper, is going on. Share with us what you're tracking and what you're seeing in terms of the changing policy context and executive orders.
Sure. Next slide, please. So this is actually a hard question to answer because of the sheer volume of policy threats immigrant families are facing right now, all of which have serious consequences for child well-being. Since the first day the Trump administration took office and in the weeks after, they've issued dozens of immigration executive orders and other executive actions aimed at 3 primary goals. The first has been to significantly increase immigration enforcement, both at the border and in the interior, to make it harder for asylum-seeking families and children to enter, and also to implement a deeply harmful mass deportation agenda. For example, and I won't be able to cover every single order, but for example, on day 1, there was an executive order calling for a significant increase in immigration agents and detention capacity, as well as to increase the number of agreements between federal immigration enforcement and local police, as well as to target sanctuary jurisdictions who've elected not to enter into such agreements. So as a result, over the past few months, we've heard case after case of individuals with no criminal record and many who are parents of U.S. citizens who were previously granted discretion and work authorizations who have arrived to complete their regular check-in with ICE only to be issued deportation orders or in some cases immediately detained and separated from their families. And just a few weeks ago, the administration announced the return of the harmful practice of family detention, and there's already a facility open in Texas that is housing some families with children that are toddlers, very young children. And this is a practice which child health experts have confirmed time and again to be deeply harmful for children. The administration also recently invoked the 1798 Alien Enemies Act, which has not been used since the internment of Japanese residents and citizens during World War II, in order to bypass immigration laws and carry out such deportations. On day one, the administration also rescinded a policy known as the Protected Areas or Sensitive Locations Policy, which is a policy that has existed in some form for more than 30 years to restrict immigration enforcement actions in places deemed critical, like schools, childcare, and early education centers, and other places of learning, as well as hospitals and other healthcare settings, places of worship, religious ceremonies, and mass demonstrations. The most recent version of the policy under the Biden administration had also extended to places where children gather, like playgrounds, as well as places that provide emergency or disaster relief, domestic violence shelters, food pantries, and places that provide social services. After rescinding the policy, the Department of Homeland Security issued a new memo simply stating that from now on, immigration agents are to use common sense when carrying out enforcement actions in such locations. So second, there have also been several executive actions aimed at restricting access or stripping away lawful status for those seeking to enter the U.S., as well as those immigrants already here. This includes the recent decisions to revoke temporary protected status for certain people from Venezuela and Haiti, with more than 500,000 people, many parents to U.S. citizen children who have been here for a long time, are now facing loss of status as well as their work permits in the coming weeks. On day one, the administration also issued an executive order to restrict birthright citizenship, requiring at least one parent to be a U.S. citizen or lawful permanent resident. That order was immediately enjoined for being blatantly unconstitutional. But I just want to stress here that the overall goal of these types of actions to strip away status are ultimately to grow the number of people, including newborn babies, who are vulnerable to deportation. And then the last area of threats we've been seeing is around restricting access to healthcare and other critical benefits. Many of you may remember the public charge rule from the first Trump administration that led thousands of parents to not apply for critical nutrition and healthcare programs, even for their citizen children, in fear of it compromising their ability to get a green card. And while we have not yet seen another public charge rule, we did see an executive order in mid-February, which seeks to discourage undocumented immigrants from accessing federal benefits. The order requires federal agencies to document which programs provide benefits to undocumented immigrants, although it does nothing to impact eligibility under current law, serving primarily as a tactic to create fear and confusion because undocumented immigrants are already ineligible for most federal public benefits. However, it's important to note that specific executive order has created a lot of confusion, especially as the federal agencies have issued guidance around it to try to implement it. So, for example, we've heard from many WIC and Head Start providers who are now concerned about whether they have to start tracking the immigration status of their kids and parents. Finally, I just want to emphasize that the fear and confusion of all of these executive orders is the entire point. And it's also important to remember that it's the cumulative effect of these executive actions that create the greatest harm to children, because together they seek to undermine virtually every aspect of child well-being at once and leaves families scrambling to deal with all of these changes, and also providers scrambling to deal with all of these changes all at one time.
Wendy, that is so much. Thank you for the synopsis. Hard it is to hear. I just want to make sure that we understand which of these executive orders are in effect, whether they're being implemented well or not, and which are being held up in the courts.
Well, as I mentioned, there almost all of these have been that I've mentioned have been challenged
Mhm.
already. There are some there's been several orders related to enforcement that are currently that have been enjoined. The order related to birthright citizenship has been enjoined. And has been and then we've also seen some challenges to the rescission of the protecting the protected areas sensitive locations policy. There was a lawsuit brought by Denver Public Schools as well as by several faith-based denominations, and currently there's a case in Maryland that's moving forward, and there's currently protection for places of worship while that one lawsuit moves through the courts. Several others are still in process. There was one recent decision with regards to literally just yesterday on the TPS for Venezuelans. Some of those cancellations of work permits are going to be delayed. And so the litigation has been really important, but there are, I will say that unfortunately though, like there are like some of the orders that kind of allow parents, for example, to be detained and deported. Those are moving forward, and that's why we are seeing so many parents now facing removal orders. And then there's also this, as I mentioned, there's this executive order, which really doesn't do anything to change the law, but it does create a lot of confusion and is, in some cases, we're hearing about providers that actually should not be denying services to undocumented immigrants or immigrants at all, and are doing that because they're worried about whether or not they're going to face ramifications for doing so.
Mhm. Thank you. And I know that your organization tracks this and you'll be providing resources and ways for people to keep up. I want to, at this point, bring the rest of our panelists on and invite Adrian from Abriendo Puertas to share a bit about the national survey that you conducted recently. We heard from Wendy about what's been happening at the federal level, but really, how are parents understanding and reacting to the changes in policies? So if you could start out and share with us about the survey, who you talked to, who you surveyed, and then we'll hear a bit about the reactions.
Great. Thank you, Cecilia. And thank you, Wendy, for that presentation. If you could go ahead and bring up my slides, please. At APOD, or Abriendo Puertas Opening Doors, we conduct an annual National Latino Family Survey of parents and caregivers with young children under 6 years old, and also include expecting families. Next slide. We partner with BSP Research as well as Unidos US to collect opinions from approximately 1,500 parents and caregivers. We use a blended collection approach that uses both online surveys as well as live telephone interviews. And we conduct the interviews in both English and Spanish. This is the fourth survey that we've done dating back to 2020. And so if folks want to go on to nationalsurvey.ap-od.org, you can see the previous surveys that were conducted. This is actually, we are sharing with you new data that has just been released. We actually don't have the report yet online for what you're going to be seeing today. So our audience today will be getting this data for the first time.
Oh, we're getting the sneak peek. Thank you.
Next slide. So some of the demographics as far as who we're talking about when we did this survey. So we interviewed 66% of respondents were U.S. citizens. 69% including Puerto Rico. 31% are foreign-born, and out of those 31%, 88% say that they have children that were born in the U.S. When we look at their countries of origin or their ancestry, this follows national trends, with 63% saying that they can trace their family ancestry back to Mexico, 10% Puerto Rico, and then we have Cuba, Dominican Republic, Central American, South American, at under 10%. Next slide. Out of those that were foreign born, 54% are naturalized US citizens, with 21% being legal permanent residents. We also have a good percentage that say that they have a visa, a temporary work authorization, or DACA that was described by Wendy in her presentation. We do have a percentage that say none of these or prefer not to say. We do have a good representation across different political parties. So it's important in our survey that we get a really good sample across different political beliefs. So we have 40% that say they lean toward or consider themselves Democrats, 25% lean toward or consider themselves Republicans. And then we see this a growing trend across the country of a growing percentage that say that they're independent or don't affiliate with either party at 21%. And then an additional 15% say neither Democrat or Republican parties. Next slide.
Sounds like the rest of the nation in that regard. So you talked to such a range of people. What were they saying?
So next slide, please. So as was shared by Wendy and has already been discussed, we really are talking about a complex situation, right? There's households who have mixed immigration status. But one thing is very clear when it comes to the Trump's administration executive order, as was explained by Wendy, of allowing enforcement in areas like sensitive locations. 65% said they completely disagree with this. And out of the 65%, 52% say they strongly agree with this executive order. We are
Agree or disagree?
Disagree, I'm sorry.
Okay, sorry, I heard it and I thought, what?
Disagree.
Okay.
We further ask parents and caregivers about how this is impacting their concern and how they interact, right, with the different institutions. And so when asked about making a medical appointment for their children or seeking health care for them, 37% say they are concerned about immigration status. And again, this is mixed status families, some of them being US citizens, but being concerned about medical appointments and immigration status when they're taking them themselves seeking medical care or for their children. Next slide. Here we continue to ask additional questions about the Trump administration's mass deportation plans and how they might start avoiding very specific activities. And as we can see here, 1/4 to 1 in 3 are saying that they might start avoiding many of these different activities that you can see here. Going to work, 1 in 4, visiting a doctor or clinic, talking to school officials, renewing or applying for a driver's license at 27%, signing up their children for school programs or early childhood development programs. 30% are saying that they might start avoiding this. Signing up for public benefits for themselves or their children at 32%, and talking to police or reporting a crime at 35%. This being important, we already know that Latino children have lower enrollments in quality early childhood programs. And here we're seeing that an additional 30% are now saying that they might avoid this. Many immigrant advocacy groups and different community groups across the country talk about how these mass deportation plans can impact public safety. And so when we see that 35% of Latino families with young children are saying that they might avoid talking to police or reporting a crime because of the fear, this is powerful and this is impactful and will impact public safety. Next slide. When we ask specifically, again, really understanding that our families live in different mixed status situations, 57%, so over half, are saying that they worry that a friend or a family member might be detained or deported due to their immigration status. And as was said early on by Dr. Sparrow in his introduction, Latino families are saying that they support a comprehensive immigration reform bill, a bipartisan bill that includes a pathway to permanent residency for citizens and citizenship for immigrants who are already in the U.S. We see high support for this at 73%. So as you can see by this data, what we're seeing now in the current climate is definitely impacting the way Latino parents and caregivers are thinking about how they interact with the institutions in their communities.
And I really want you to go back and focus again on what's happening with schools and early learning centers. What's the implication of families saying that they don't want to talk to teachers?
That's a great point. What we're seeing, and there's in a maybe in a normal environment where there's due process, families feel like there might be some relief and that they might have an opportunity, right, to not just know their rights, but to be able to interact with institutions without fear of deportation. But because we are hearing from families that are being caught up in immigration enforcement situations, or being asked about their immigration status when even being U.S. citizens or here with a permanent residency, there is this fear that's happening within the community. Now, what we always express and what we always talk to about our family serving organizations in our communities, that it's important to have accurate and true information, because there is also a lot of misinformation out there. And so although we might be seeing on the news that there are cases, right, where folks are getting caught up in immigration enforcement, it's important that we understand what's happening in our local community, because there is additional protections, right, in certain states or local jurisdictions when it comes to immigration enforcement.
Yeah, and I think we'll come back to this point later on. Thank you so much for sharing what you've learned. I know people are eager to get your report. Any ETA on when it's going to be published?
Yeah, well, we're actually going to share some links here that I'll put in the chat of where they can get some data already. And of course, this data that we're sharing is early data, and the full report will be out in May of this year. Yeah.
All right. I can see on May 1st, there's going to be a lot of clicks on your website.
And
Thank you.
end of May, I should say. Yeah, thank you.
Oh, okay. You're going to buy yourself some time. I hear you. Okay, thank you. Myra, I want to turn to you and the Children's Partnership, which is really focused on child health. Talk to us a bit about what you're seeing in the impact of these policy shifts on children's access to and utilization of health services. It can, please share the full range of what impacts you see.
Sure, happy to do so. And thanks for the question, Cecilia. And I think my comments really build on both Wendy's and Adrian's, talking about both the direct impacts of immigration enforcement and immigration policy, but also the indirect impacts on child health and well-being and access to healthcare services. So I think first, as advocates for children, as community members, I think we have to consider how healthy development occurs in children, particularly young children, but children across the childhood spectrum. They really develop in the context of relationships. Young children use their relationships with their parents and their caregivers to literally regulate their own physiological responses. They depend on those relationships to form their own understanding of what relationships should look like. It really provides that security, that base for exploration, for learning. And of course, they're learning about how to behave based on those relationships. And they also experience fear, pain, suffering, all of the interpersonal complex trauma as a result of those relationships. And I say that because as we think about the implications on child health and well-being of immigration policy, you can't separate a child's health from that of their parents and caregivers. So as we know that parents and adults in the lives of these children are worried about deportation, are worried about detention, are confused by the changing policies, that then impacts the very environment in which we are raising our children. And as we saw in Adrian's data, as we have seen in past data from the first Trump administration, there is so much evidence that demonstrates what that might look like. I know CLASP that did their research with childcare providers. We did our research with immigrant families and providers serving immigrant families that demonstrated a number of physical responses to the environment.
Mhm.
Things
Say
like,
more. Mhm.
yeah, things like increased aggression in children,
Mhm.
separation anxiety amongst children, a decreased engagement or withdrawal from their environments. If one study found that nearly 30% of children with one or more undocumented parents reported being afraid nearly all or most of the time. Carrying that fear, that manifests in different ways and literally gives us a physical response of having to
Mhm.
always be in this flight or fight mode that has
Mhm.
long-term damaging impacts on children. Again, not only on those formative years and the development of young children, but long, serious, lasting effects on their physical and emotional development. For those of
Mhm.
us
That
that are
toxic
listening,
stress over time.
exactly. You took the
Mhm.
words right out of my mouth. That is what that persistent, that substantial exposure to fear and anxiety, which is referred to as toxic stress, that's what's
Mhm.
doing immense damage to children's health. And as Wendy referenced in her comments, this is absolutely for children that are part of undocumented families or mixed status families, but it's also that broader community of children that are part of immigrant families more broadly, but also that share a classroom with a child in an immigrant family, that play on the playground and that they have questions about what's happening. Our children should be focused on what they're playing with, what they're learning in the classroom, right? Not about, is my friend going to be safe? Or why isn't my teacher showing up in the classroom? Those are long-standing implications on their well-being that we're only starting now again to re-see that again, right? And I will tell you, even we did a study of healthcare providers. Again, this was back under Trump 1.0. And we've got some like 70% of providers reported that families were uncomfortable doing everyday activities like going to the park or going to the grocery store. Like that chilling effect is alive and well, and it's intentional by these policies that are causing confusion and that are influencing behaviors as a result of people living in fear. And again, that's intentional. So when we think about our commitment to child health and well-being, we have to consider not only the direct impacts of what these policies have the potential to do, but the indirect impacts on the tens of millions of children that are connected to immigrant communities more broadly.
Mm. Thank you for sharing and bringing up some of the, again, very chilling statistics. Wendy, I want to turn to you again. Myra alluded to some of the work that you've been doing at looking at our youngest learners. And I wonder, Wendy, if you could share a bit about access to childcare and early education programs.
Sure, I'd be happy to do that. As Myra alluded to earlier, we did a study in under Trump 1.0 that we went to 6 states and we spoke to more than 150 parents and early childhood educators to get an understanding of how immigration policies were specifically impacting young children. But because we were speaking to early childhood educators, we actually learned a lot about how the policies were also impacting the programs and the staff themselves. And as a result, we ended up publishing 2 reports, one that looked at the impacts to young children, the findings of which largely reflect everything that Myra just pointed to, including, I think the only thing I would add is like the financial strain on families if they lost a breadwinner or lost access to work permits. And then we published a second report focused on the impact to the early childhood programs themselves. And I think I think it's what we found in that study is a lot of what we're hearing from providers right now. And because as we've been hearing from people since the election, and then like a significant increase in requests for technical assistance from early childcare and early education providers since day one of this Trump administration. Our initial study had found that programs were experiencing drops in attendance, lower levels of parent engagement, and difficulty enrolling new families. And similar to what happened under Trump 1.0, what we've been hearing again now is those same things, but also that program staff are once again really stressed. They're feeling helpless in their efforts to support families and navigate all these changing policies. Whether eligibility has changed, whether what does it mean if ICE comes to their door now, um, and and the requests just keep pouring in because there's so much uncertainty. And I will say that the challenges that both providers and those of us trying to support them are facing are increasingly complex because of the policies changing so much and because we don't have protections that we used to have. And it's also very complex because it often depends, um, like the extent to which providers can implement their own types of policies internally may depend on the type of political climate in their state, as well as program administrators who may be less reluctant to provide know your rights materials to parents or to train their staff on what to do related to immigration enforcement because they're afraid of their funding potentially being impacted. And those concerns are real, and because we are seeing cuts to programs around the country. And I think it's also important to remember that immigrants comprise nearly 20% or 1 in 5 of the early childhood workforce in the US, filling critical roles that meet the linguistic and cultural needs of our increasingly diverse child population. Many have TPS or another status that's currently at risk, and they're actually worried about whether they'll be able to keep their jobs. Which is not only critical for their own family's economic well-being, but also for the childcare sector at large, which is already facing a labor shortage. So the impact of it's not only about the programs having facing challenges to families being able to access them, but even just to keep their doors open and to keep some of their best staff in their jobs. And a lot of our questions that we're getting now is with regards to what to do if ICE comes to their facility is not only about how to keep parents safe, but how do I keep our staff safe?
Thank you for that. And just as I listen to this, it's that domino effect that results in such negativity for the children. So you're at home, mom and dad are stressed, they're fearful. Then you go to your childcare program and the staff are stressed. So this cannot be good in so many ways. We have some questions in the question and answer box that we'll come back to later on, but I am aware of the time. So I do think at this point, I would like to share a little bit from my point of view as somebody who's worked with the campaign for grade level reading since the beginning. And the impact on attendance. So I just want to share a couple of items that you can click through, Sierra. Attendance in pre-K 12 is really important. And when we hear about students not being able to attend from the very beginning in these early care programs throughout K-5, what we see is students not being in class. They end up not reading at grade level by 3rd grade, which is the key metric that the campaign has been driving forward to. And if this continues, it's about achievement in middle school and graduation in high school. So this is really something that has long-term impacts academically, as well as the social and other impacts that our speakers have been sharing about. If you could go to the next slide, please. We really think about those relationships. I love, Myra, how you talked about the relationship being the way that young children thrive and grow. And we know that attendance improves when children feel physically and emotionally healthy and safe when they're in school. And we're hearing about all the ways in which they do not experience this currently. And that sense of belonging and connection and support to caring adults who are emotionally healthy themselves really matter. And finally, children attend school because that's where they experience the fun and joy of learning. So next slide. What we're really seeing is the tail end of an attendance crisis that isn't over by any means. We hit the high point of 30% chronically absent, came down a little bit to 28%. And we're still seeing elevated levels. We're nowhere near pre-pandemic levels of school attendance. Next slide. And we see the impact on English learners. Not all immigrant children are English learners. But the vast majority are. And we see in the data that a third of them are chronically absent. So they are definitely affected in school attendance. Next slide. And what we do know from, I think what everyone's been referring to as Trump 1.0, the impact of ICE enforcement on school attendance is clear. Last time around, study showed that students 5% in elementary school, 8% in high school were more likely to be chronically absent after ICE enforcement. And what helps, and I want to turn this towards what might be helpful, is are two things. One is in the attendance playbook, it's about schools being clear in how they're going to deal with ICE coming on campus. If there's clear policies, clear direction, so that staff know what they can do lawfully and what they cannot do. And second, it's family engagement. It's families trusting that the school will take care of their children and that it's a safe place. Those are the two things that mitigate against this sort of threat. It doesn't solve it, but it helps. So I just wanted to put this in context and share with you another key piece of what it takes to respond. Okay, so we are going to turn now and bring the panelists back. And at this point, I think, Myra, I'd like to return to what you were sharing about how children's well-being and mental health have been affected. And perhaps you can share some strategies and resources as well.
Sure, happy to do so. I think one thing that I want to pick up on is again where Wendy left off. Wendy talked about that there are multiple implications for how immigration policy impacts families. We talked about the mental health and well-being of children. She raised the importance of the economic impacts of losing a breadwinner, for example. And I think that really highlights to me, Cecilia, just what these policy changes are signifying or signaling in our country as a whole. That this attack on immigrants is not only an attack on immigrants directly, but an attack on our safety net, an attack on the very principles and ideals on which we as Americans believe, like many of us who believe in this country and the promise of this country, right? And you see that not only in the immigration policies that are getting introduced, but the cuts to Medicaid that are being proposed, the proposed cuts to Head Start in the future, the questioning of research, medical research. These are core programs that I think many of us of all walks of life understand the importance in raising healthy, thriving children and how these policies are all connected. And so I think there's this false narrative that is what the American people voted for. And all of us, I believe, are here to say, no, it is not. That is not. There are families struggling across ethnic lines, across immigration status, across every economic status. Families are struggling. Let's have a conversation about addressing that for all of us, because a solution that will work for low-income immigrant families will have incredible impacts on all of us that are struggling. So I want to emphasize that interconnectedness between who we are as Americans and who calls this country home and the experience of immigrant families today.
Thank you so much. That's such a powerful statement, and it's a direct counter to the othering, right, of immigrants and immigrant students. Appreciate that so much. In terms of children's well-being and mental health, Wendy, what might you share about improving that and addressing some of the trauma of detention and deportation. And this is one in which I suspect everyone wants to comment, but I'd like to start with you, Wendy.
Sure. Well, I think, I just ditto to everything Myra said. And I think I wanted to also talk really quickly about like the trauma that children that are recently arrived are facing, because I do think that families that have recently arrived and have been here for just a few years are those that are some of the most vulnerable right now. And I think obviously like all of these threats are particularly traumatizing and re-traumatizing because a lot of these kids are just beginning to heal from the journeys that either they did alone or with their families and are terrified of returning to places where there is like severe um, gang violence and other violence that's specifically targeting their families even. And so it's, people are really worried about being deported to countries where they would be put into harm's way. And for unaccompanied children specifically, someone posed a question about this earlier. So I wanted to speak also to the executive order that actually is taking away. I mean, we're trying our best to get children supports, and the administration just issued an order last week to basically cut all legal representation for unaccompanied children. So they're actually now there's going to be once again children as young as 8 years old facing a judge alone without legal representation, which we know not only helps them access relief, some sort of immigration relief, but also provides them all sorts of other protections from possible exploitation. So in terms,
Shocking, Wendy.
right,
That is shocking.
it's shocking. And so I will put into the chat a URL that I shared for people to help send letters to demand that program be reinstated. They're close to their goal of 200,000 letters. And there are like at least 25,000 children that are already have lost their lawyers, and hundreds of lawyers that have been laid off around the country who have committed their lives to serving these children and helping them connect to safety and a better future. So we need a lot of supports for those very vulnerable kids. It's easy to target them because they are so vulnerable and because they already have such few protections. And then obviously speaking out against family detention is very important. We had a lot of advocates that went out to visit those facilities just last week. And then for families that are facing potential deportation, that are, at risk because they're either undocumented or at risk of losing their status, what we have found that is really important is being able to connect families to resources for how to prepare for deportation. And so we have been sharing some resources from our friends at the Immigrant Legal Resource Center, as well as others, on how to help families have a plan. Because even in my experience working with kids and talking to children, what we're hearing is, I mean, the uncertainty that kids have in terms of what's going to happen is exacerbating the situation. And as hard as it is, we need to help parents. We need to support them. And we have, actually, I know Adrian has some resources on this. We need to help parents be able to, to have this hard conversation with their kids, because it actually does, as terrifying as it is, it does help for kids to know what the plan is, who they're going to go with, what's exactly going to happen, and when they might be able to reunify with their parents, because the not knowing is almost more scary.
That's great. And I loved how you are referring to Adrian. Adrian, can you talk about two things? First, in response, what are the ways in which families can have a plan and help be ready for perhaps the worst situation? And then share a bit about what you're seeing in your work. You don't do surveys 100% of the time. When you're working directly with families, what are you seeing in terms of the impact on their health and well-being?
Yeah, thank you, Cecilia. Well, one is Wendy and Maida have said there are so many incredible resources that are being dropped in the chat here on family preparedness. It's important that we don't live in fear, right? But we be prepared and have a good plan in
Mm-hmm.
place, so that we know when we go to work, drop our children off to school, that we do have a plan in place, that of knowing who's going to maybe care for our children in a case of deportation. And it's like anything else, right? In our lives as parents and caregivers, we want to have a plan in place, right, in case of any emergency. And so that's important to have that in place. There are documents that you will see and some of the resources that you can fill out, together with the other family members. And it's important that parents and caregivers right now in our work at APOD at Abriendo Puertas Opening Doors, we work to really ensure that families have trusted relationships in their communities with other family members, with their peers, other parents and caregivers, and local community organizations, right? Their local schools, local Head Starts, community-based organization, advocacy organizations. Those are essential, right? That those are part of the ecosystem that supports parents and caregivers. We know that in hearing, talking to families every day, that they're continuing again to, go to work, to live, their best lives, to be hopeful about the future. We want, right, our parents and caregivers to be hopeful and to talk to their children about being hopeful and the incredible future that's before them. Again, we don't want to live in fear. And so it's important, right, that parents and caregivers have open, honest, communication with their children at a very young age. We always say at APOD that try not to watch the news with your children. Don't leave the TV on, because the news, is meant, right, to put out, the most kind of shocking piece of information or the one story. And if they are seeing the news, to talk to them and to debrief and to have a conversation with them about what they're seeing. At APOD, we have a wonderful video that folks can go to that really speaks
Yeah,
to
I think
the
Sarah just dropped it in the
Oh,
chat.
great. Very good. Thank you.
She's been steadily following all your comments and putting resources in the chat.
Cecilia, can I just add one thing?
Yes, of course,
And
Myra.
also that builds on Wendy and Adrian. There's this, in my generation, I'm from California, so we always had like earthquake preparedness kits.
Yes.
When we knew how to stop, drop, and roll, if there was a fire, like we are preparing kids for natural disasters all the time. Unfortunately, more than we'd even want to, right? Natural disasters. What we are grappling with right now is a man-made disaster that this administration has put forward on our communities, and we have to educate our families in the exact same way, because there's a lot of concern about causing panic, and we don't want our families to panic. At the same time, we want them to be as prepared as possible, and we want our fellow community members to be as prepared as possible. And so normalizing that preparedness plan, normalizing the preparedness conversation as part of preparing for a natural disaster will help equip all of our community members with the information they need to stand up for their rights and protect their families, and also all of us that have a role to play in creating that, beloved community that we all believe in. So I want to emphasize that point that we're in this together, and that it is on all of us to ensure that we're using those red cards, we're following that guide that Wendy created, and really taking that next step and educating ourselves and helping educate and protect our community members as well.
That is so well said. Thank you. Be prepared. And I see you. I see you. Just a second. I also think that it's not just on the backs of our parents, right? For our childcare providers, knowing what is legal and what they can do or they are not required to do, that's important. For our K-12 educators, same thing. Being prepared. You are not supposed to be asking about a family's residency or legal immigration status. That is law. That is not something that you get to make up on your own. We are still a nation of laws, and you need to know what you're supposed to do. So just wanted to say these things, that being prepared not only extends to children and families, it extends to all our institutions, the ones that are meant to serve and support. Okay, sorry, I had to get that off my chest, Wendy. It's so hard to moderate when you want to converse. What were you going to add?
No, I'm very glad that you said that. It actually set me up perfectly for. I had just neglected to mention that we also have, and Myra mentioned this, our resource, our safe space guide for early childhood educators specifically. provides like it's a toolkit essentially for creating your own policies for what to do if immigration enforcement comes to your centers. In addition to the toolkit, we also are providing technical assistance as much as we can on a one-on-one basis. So if you want a training, please feel free to reach out to our team. We are happy to do that.
Thank you so much. I can feel the conversation turning from facing the grim reality, reframing it, and now we need to leave with some hope for all of us, despite how hard times are. So, Adrienne, I want to turn to you first. Are there any bright spots, anything you see where educators, schools, community partners are coming together to help children feel more safe and secure?
Yeah, I think that's the key, is the coming together, right? Is being in relationship with other folks, with incredible local community groups. At we have Abriendo Puertas, Opening Doors, classes being facilitated throughout the country, where parents are able to come and learn about early childhood development, talk to each other, share each other's experience, share resources on immigration. We know that families trust each other, right? In our survey, 92% of families say that they trust their other family members at high levels. What's also important is, for the audience listening, 86%, next in line, 86% say that of Latino families with young children say they trust nonprofits, community organizations. And so there's a high level of trust. I think that's because of the pandemic, where nonprofits really stepped up, and they were there, for families, but a very high percentage, 86%, say they trust nonprofits, community organizations. And then next we have doctors, schools, and faith-based organizations, all above 75%. So there's high trust of families, of their local institutions, and so that's very important, that although we might feel like there's distrust out there, that, those local organizations that families are in relationship with, that's where they're going for resources. And so, hats off to all the great work that's happening, from our audience members out there that are listening in.
Thank you for pointing out to those positives. For the rest of the panel, what recommendations would you offer to those who are working to support early school success? What can others in the audience do to support child well-being and build that trusting relationship with families?
I can start. I think this idea that we are all in it together, it seems very pie in the sky, and like there's this dominant narrative that we're so divided. And I think we all have the opportunity to really lean into that and work more closely together across sectors. I think, as a traditional child advocate, to be able to rely on our immigration-led partners like Wendy, like other organizations like CHIRLA and California Immigrant Policy Center and NILC, like that's incredible, right? But that requires work and relationships to build connection and community with each other. I think, for my partners in the South and in the Midwest, like creating those relationships is so important. I also think across sectors, the children that we're fighting for in those childcare centers are most likely also reliant on Medicaid. They're also most likely reliant on food stamps. So these public programs that are under attack, there's an opportunity to lean into connection and be intersectional in our advocacy to fight for immigrant families. We see that in our All In for Safe Schools campaign here in California that brings together our immigration advocates, the ACLU, us, our education folks like the California School-Based Health Alliance, but also Equality California, recognizing that the attacks on immigrants are at the same time that we're seeing attacks on trans kids and LGBTQ kids. And we want safe and welcoming environments for all our kids. So how do we lean into that partnership opportunity? So that's one. I think that there's a real silver lining. And I think the other one is, in particular for many immigrant communities where we don't talk about mental health and we sort of brush it under the rug, being able to build the capacity in ourselves as parents, as community members, to talk about mental health and talk about how it shows up and equip ourselves with that is something that all of us need in our community at this time, because it is a traumatizing experience for our children and our parents, and it's our responsibility to equip ourselves with how to have those conversations, and how to, in our little kitchen table conversations and our talks with our comadres, how are we talking about mental health and supporting each other in that.
Could I
Love
just jump in? Could
Hi,
I just
Josh.
jump?
Yes, of course. There you are.
I just wanted to add to what Maito said, and it's something that you said recently, Maito, that I heard you say. Maybe you said it today, but it's so important and within our reach, which is to let people know you are welcome here and we love you. And when people know there are good people out there somewhere who really care and who really get it, it can help mitigate some of the harm that comes from feeling isolated, which is one of the many terrible things that is happening as a result, and not being able to trust. So, Maida, when you said that a couple of weeks ago, create a really welcoming environment and let people know we are here for you. We are not going anywhere. We care about you and we love you. I just thought was so important, and we can certainly do that.
Thank you, Josh, so much. Before I ask the last question about sharing resources, anything else you might want to say? Wendy, I think we were getting so impassioned that we skipped you. Did you want to share anything about no? Okay, then
No, I
let's
mean, there is one thing I wanted to share about resources, but I think Adrian was also going to weigh in, so I'm going to let him go first.
Oh,
go
no.
ahead.
Yeah. No, I was, also going to go back to what Dr. Sparrow said early on in the intro that, to tell and to our personal stories, immigration stories is important, right? To again talk about either, past, present, but to really share the strengths of our immigrant community in our own stories, I think is important. And, we can't allow the political rhetoric and media to define our immigration story. We have to tell those stories more. And so in all spaces, right? So, across sectors, as Maida said, so that, that's extremely important because, as Dr. Sparrow said, immigrants are not the problem. We are a strength and the fabric of this nation.
Actually, I'm glad I let you go before me, Adrian, because that actually I was going to mention that there's been messaging research done that also shows how important when we're trying to appeal to like those that can be persuaded on these issues, like how important messengers like educators and childcare providers are. So it's those folks like many of you on this webinar that are doing the work and working with families every day that are the most effective messengers on who immigrant families are and what kind of immigration policies we want in this country. And I also just wanted to quickly flag and put a plug in for one of the campaigns that was shared in the chat, which is the Education for All campaign. Our friends in Tennessee are currently in a big fight to try to protect every child's access to a K-12 education, regardless of immigration status. I haven't checked the update yet. I don't know if it's actually passed the Senate Finance Committee, but that bill is moving very quickly. And if passed, could actually make the case referred to known as Plyler v. Doe, which was a 1982 Supreme Court ruling that guarantees access to K-12 education for all students, regardless of immigration status. It could return to the Supreme Court, and we could have an unfavorable decision and lose that right that has been so critical for children to have access to a basic education. And so there will be an opportunity for there to be national, support from everyone, including those who are educators themselves and advocates. So I would just encourage folks to check out the Education for All website to learn how to get involved.
Thank you. Okay, well, I have asked you many, many questions, and the answers have been inspiring. We do have some questions from the audience that I'm hoping you could respond to. So many of the questions have really been on about the effects of restricting access to health insurance, Medicaid, and health care. Could any of you speak to that particular aspect?
Yeah, I can start, absolutely. So I,
Thanks,
I think absolutely. I think it's important to keep in mind that there have yet to be any specific policy changes to eligibility for
Mm,
Medicaid. And I should start by saying right now, no undocumented immigrant is eligible for any healthcare services besides EMTALA, which is Emergency Treatment and Labor Act, which is basically if you're on your deathbed or you're about to have a baby and you show up at a hospital, legally and frankly, morally, we have the responsibility to care for this person, right? So I think that's a misconception that our federal dollars are supporting undocumented immigrants in their healthcare. So that's first. However, there are rumors and there are writings, particularly part of Project 2025, that have indicated that this administration will further limit opportunities for immigrants broadly access to healthcare. And this is true because right now there are opportunities to grant access to healthcare services for immigrant communities. For example, states can waive a 5-year bar for public health services like Medicaid. Right now, one of our laws is that legal immigrants have to wait 5 years before they can access certain health and social services. However, states with their own authority can choose to waive those 5 years. This administration may decide to change that. Additionally, DACA recipients, Deferred Action for Childhood Arrivals, just in the Biden administration most recently, they put forward a regulation to allow DACA recipients to purchase health insurance coverage on the health insurance marketplace, the Affordable Care Act, Obamacare. It goes by a lot of different names. And they just issued a regulation, a proposed regulation to rescind that allowance of DACA recipients to purchase coverage on the exchange. It has to go through the rulemaking process. So there's an opportunity to hear public comment and get some feedback on what's happening. But again, it's the action, it's the rhetoric, it's the combination with other efforts that have put forward against immigrants, against public programs, that is causing confusion and is creating this chilling effect that is deterring access to important health and social services for families. So we are on high alert for any possible changes that may further impede access for immigrant families. And then again, by default, the children in immigrant families, whether they're immigrants or they're US citizen children who are part of these families. The last thing I will say, Cecilia, is that one of the top indicators for an insured child is having an insured parent. So the idea that we can just take care of the kids is an impossible reality. Children are part of families and families are part of communities. And it is our responsibility to consider that context when we're writing legislation and moving forward policies.
Thank you so much for clarifying concerns, perceptions, fears versus what's real and factual. That is so important. And I would say that one of the chilling effects that happens is that when programs, community-based organizations, school systems are uncertain about funding, they just freeze. They don't know what to do. You can't make plans based on uncertain revenues, so you freeze. And that, I think, is another one of the chilling effects. We're going to wrap this up, but would anyone else like to chime in on this issue of Medicaid and health access? Okay. All right. Well, I want to say thank you, Myra, Wendy, Adrian, Josh. You all are so inspiring in your work. Thank you for your generosity and everything that you've shared with the audience. Just thank you so much, and I wish you continued success as you continue the work. So I'm going to turn things back over to Sarah to close us out.
Ditto what Cecilia just said. Thank you all so much for everything that you have shared today, for joining us today, but really more importantly, for the incredible work that each of you is doing in this really challenging time to support children, support families, fight the misinformation that you have just described, is having incredible and real concrete impacts on children's access to healthcare. access to learning opportunities, access to a healthy environment and a non-toxic environment, and to grow and develop, and their families as well. This has been such an important conversation, and I hope you've seen all these hearts that are flying up now. They've been flying up throughout the conversation for everything that you've shared. All of these resources, people have been asking in the chat, yes. Every link that I shared that our panelists shared with me beforehand, I'll be sharing that in a follow-up email that all of you who registered will receive on Friday, including, I think there were lots of additional links that were shared in responses to some of the questions in the Q&A box earlier. Just huge thanks to all of you. And thank you to you, Cecilia, for navigating us through this conversation and lifting up both kind of the challenges, but also the recommendations and the opportunities in this moment.